How many of you have had your doctor ask you about sex, your mental health, alcohol use? These questions are almost universal. But how many of you have had your doctor ask you about money? Most of us haven't. But that is strange because compared to most high-income countries, child poverty is an epidemic in the United States. It creates conditions that may elevate stress hormone levels and impair brain development. Poor children in the US are 1.5 times more likely to die and twice as likely to be hospitalized as their middle-class counterparts. So, my colleague, Dr. Michael Hull, and I started asking moms about money. We knew we needed to reimagine what a doctor's visit looks like to get kids out of poverty and to give them a fair shot at a healthy life. Our questions led to a surprising solution: tax credits. It turns out the Earned Income Tax Credit, or EITC, is the best poverty prescription we have in the US. The average mom gets $2,000 to $3,000 a year from it. When families get it, moms and babies are healthier, fewer depressed moms, babies weighing more at birth. But 1 out of 5 families who could get it doesn't, and most who do lose hundreds of dollars to the for-profit tax preparation industry. One day, a mom asked us why we couldn't do her taxes while she waited for the doctor. We all know that purgatory. Why not make good use of that time? So we started Street Cred, an organization prescribing tax preparation and clinics serving kids. This is a brand new approach, and one that left some questioning our sanity. After all, we're doctors, not accountants, but we have something accountants don't: access to families. Over 90% of kids in the US see a doctor at least once a year. Their parents trust us and will do anything to give them a better life. Doctors in every clinic around the country could be doing this work too. It's simple, really. The hospital registers as a tax preparation site, and everyone, from medical students to retirees, can volunteer as a tax preparer after passing an IRS exam. It's not as hard as it sounds, I promise. I certainly never thought I would be doing other people's taxes, but here I am. We're nearing the end of our 3rd year. In the first 2, we returned $1.6 million to 750 families in Boston alone. This year, we've expanded to 9 sites in 4 states. 63% of our families have never heard of the EITC. How can you claim something you haven't heard of? And half have never used free tax preparation. That $2,000 to $3,000 a year goes a long way. Take hunger. An adequately nutritious, low-cost diet for a mom and 2 young kids costs $477 a month. With EITC money, that family can eat for 5 to 6 months. Or think about medical care. 20 million children in the US lack access to care meeting modern pediatric standards. And yet, the average cost of that care is only $400 per kid per year. EITC money can help fix this access problem. Perhaps most powerfully of all, this money gives moms hope. One mom used her refund for her son to study abroad in Spain. She was struggling to pay her rent, but she saw EITC money as his shot at a better future. We have an opportunity as doctors and as citizens to get to the root of this problem. We can reimagine healthcare as a place addressing the causes of poor health, be it infections or finances. Thank you.